Dear NEET UG students, let me ask you one question. Is MBBS the only option after NEET UG? The answer is obviously no. That's why I'm making this video currently. I know about 23 lakh students that are going to give NEET UG this year. Re-NEET 2026. What are the career options that are available apart from MBBS is what I'm going to talk about. I'm Dr Bishwomohan Mishra, a 23-year-old doctor from KMC Mangalore. There are about 23 lakh students who are going to give Re-NEET 2026 this year. There are about 1,29,000 seats, MBBS seats, but only a few will be able to crack. What about those who are not able to get into any of the medical colleges or are financially constrained or are giving multiple attempts to get into MBBS? I know many of your parents are forcing for you to enter into this particular MBBS, and I would not mention them wrong, but I would not mention them eitherly correct as well. Today, I'm going to list out various career options that are alternative to MBBS and BDS. I guide about thousands of NEET UG aspirants for the career they want to choose, MBBS, BDS, and other alternatives that I'm going to mention today. So if you want a one-to-one personalized talk with me, kindly DM me on this number highlighted or into the email ID that's being mentioned above. In this video, I'll be talking briefly and I'll be listing out certain alternate career options. But for the detailed video regarding the salary, regarding the growth, regarding the 5 years down the line and 10 years down the line and 20 years down the line, kindly subscribe to my channel to know more about specifically each of them. Starting off with the first option, that is BAMS, Bachelor of Ayurvedic and Medical Sciences. With the advent of natural medicine, naturopathy, Ayurvedic hospitals, and certain Ayurvedic treatments that are available right now in the market, you can become a doctor, Ayurvedic doctor, in various corporate hospitals and also corporate sector. Certain Ayurvedic companies right now running, I would not mention them, are currently requiring Ayurvedic doctors a lot. So your BMS degree can be a bonus. Second option is physiotherapy. Now this is a branch which actually all doctors require nowadays. Various corporate hospitals require physiotherapists for the exercise post-operation. It could be in orthopedics, like for example, if you have a total hip replacement, total knee replacement, you require certain exercises that is given for the knee and also the hip, and also various parts which are being operated. You require exercise of the particular parts, and physiotherapists are going to be in demand in the coming years. Also, I will tell you my story. I was an intern in a hospital back then in my internship days. What I was posted is in surgery and orthopedics. What I noticed is that the requirement of physiotherapy, like OT was done, and we as interns were told by the consultants to write a physiotherapy form for each of the various cases. And I would not be amazed to tell you that there were about 16 to 17 post-operative beds, and out of which all the 16 and 17 beds were requiring physiotherapists. So that is also a branch of utmost importance nowadays. I'll be talking about this particular branch in detail in my subsequent video. The third option is veterinary. I cannot emphasize how important this branch is nowadays. In the coming years, if you're a person who loves animals and who wants to take care of animals and you're an animal lover right from your childhood, then I think this branch is for you. Veterinary deals, what you can do is that you can deal with animals on a veterinary clinic level, or you can open your clinic independently and treat pet animals and also anyone who is in the street, dogs. The fourth option is B Farm. If you're a person who is willing to go into pharmaceutical industries, wanting to make new drugs, medicines, and also want to help doctors in various companies for the new medications and also crazy and interesting sort of a corporate environment, then this branch is for you. After B Farm, you can go ahead with M Farm and join a corporate industry. The salary of a M Farm person in the pharmaceutical industry can range somewhere between starting from 10 to 12 lakhs to about 50 lakhs to 1 crore. Sometimes it can go up to 1.5 crore. I will not mention anywhere more than that. Fifth option is BSc Biotechnology. I cannot emphasize how important, how crazy, how interesting this branch is. It deals mostly with biology and technology and making something for the human studies. For example, a person in diabetic, as a doctor, I need some insulin. Where do I get the insulin from? Who makes the insulin? It is extracted by the biotechnologist with the help of genetic engineering and certain technologies which make sure that the C peptide that is made is useful for the human beings, the amplification of the a genetic product. That I think a biotechnologist will be able to tell more. As far as I have asked my friends, this is what information I've got. The second one was that during a vaccine era, new vaccines are required nowadays. For now, I think the Ebola virus is coming. Sixth career option is BSc Genetics. This branch is mostly dealing with the genetic engineering, and I cannot emphasize how important it is for the children or the newborns who are going to be born with a lot of genetic disorders due to the lifestyle of people right now. For example, we have Patau syndrome, which is chromosome 13 ka disorder, trisomy 21, which is Down syndrome, Klinefelter syndrome. You name any syndrome, like for example, in most of the autosomal dominant disorders, cystic fibrosis and all that stuff, autosomal recessive disorders, you have X-linked recessive disorders, X-linked dominant disorders, a lot of genetic mutations, Huntington disease, Alzheimer's in the old age. You guys are required. I mean, we require a person who could actually genetically go and change the particular mutations or whatever in the genetics and create a healthy human being. What is the mistake of a neonate or a newborn who is born to a person who is not having any genetic disorder, but still he or she has inculcated a genetic disorder? How can you guys as genetic engineers help the doctors and other community in creating a genetically better individual? Seventh career option is nursing. I know most of you will skip this video right now here, but as a doctor, I would like to respect and salute all the sisters out there, nurses out there, for taking care of the patients when the doctor is not available. And I cannot say how important it was during my internship phase where the sisters were taking care of the patients at night. So this is really a thankless job, and doctors are also thankless job. So this particular branch, as everybody of you know, that you can go ahead with NORCET exams, which is for the AIMS exams after your BSc nursing, and you can go ahead with all the hospital jobs that are required. These were some of the good career options post NEET UG, if not MBBS and BDS. So do subscribe to my channel for knowing more such details about each of the career options. I know it was a very brief video, but I'll be talking about each of them in the salary 5 years down the lane, 10 years down the lane, and 20 years down the lane with various career options specifically in the upcoming videos every week. So do stay tuned to the channel.